All right, Gabe, Thursday, so we always talk with folks in the medical community today, which is good because I don't know what I just put my hand in. So you may need to give me a diagnosis here a little bit. February's, we've been talking about hearts. It's been Heart Health Month. Dr. John Rommel here with New Hanover Regional Medical Center's Physicians Group. Cape Fear Heart Associates specifically. We've talked about heart disease being the #1 killer, congestive heart failure this morning. You want to just kind of give us the overview of what we're talking about when we hear the term congestive heart failure?
Yeah, so congestive heart failure is typically kind of an umbrella term for really saying at the end of the day the body is not able to pump enough blood to meet the demands of the rest of the body.
Okay. Maybe some tingling, you get to like the sensations in the extremities. Is that an indication that something might be going on, or am I overgeneralizing right now?
It can be sometimes. You know, some of the signs and symptoms of heart failure are very subtle, and so unfortunately they don't, you know, body's not waving a flag saying, hey, this is exactly what's going on. But it can be things like worsening shortness of breath when you're exerting yourself. It's some swelling in the legs and ankles. It's trouble laying flat, feeling short of breath when you do it, maybe waking up gasping for a night at night because you just feel like you can't catch your breath.
In my head, you know, I'm picturing stereotypical, you know, generally overweight. But I'm right with saying in older, I mean, can we see this in children?
Yeah, so it can happen at any age, and that's because there's a lot of reasons people can have heart failure, but it typically is a disease that occurs more frequently as we get older, with the majority of our patients being over the age of 65.
And I was asking you when Gabe was doing the weather, Gabe, we were paying attention, trust me. I was saying, you know, I don't just call my doctor and say, hey, doc, I think I have congestive heart failure. It's something, what is the progression that leads it up to where I end up coming to see you?
You know, a lot of times it's having risk factors for it, a history of coronary disease, a history of diabetes, obesity, high blood pressure, and then all of a sudden starting to recognize again these symptoms we were talking about, just saying, you know, I'm just not as, I don't have the same energy I had before. I'm starting to notice that my weight's going up, I'm getting edema down in my legs, you know, just those kind of findings.
Okay. They gave me the wrap, but I do want to ask you this extremely quick. Is this before, after, or does it not even coincide with when a heart attack could happen?
It doesn't necessarily coincide. It can typically be afterwards, but sometimes people can have these signs and symptoms and not have blockages in their heart.
Okay. And I always say, if you have any questions, call the doc. Don't call the pinhead, because I don't know, he knows more about congestive heart failure than I do. I appreciate the time.
Thank you very much.
And that's what I touched right there. We're back after this.